We're in Dublin city centre. We're just out the back of the Ana Liffey Drug Project. The team I work for would work out and about on the street, so this would be an area that would have quite high drug use, especially around the city centre. Our team expands outside of the city a little bit as well.
How would you describe this drug scene?
A lot of drug use we'd see would be heroin, so injecting or smoking. Crack cocaine, we would see a lot of tablet use, so benzodiazepines, and then there'd be a lot of alcohol use as well. And then from time to time you'd see different drug trends emerging, crystal meth, GHB, there's a wide variety of drugs around, but yeah, I'd say mainly we'd work with heroin, crack, tablets and alcohol use.
Who is Ana Liffey?
Who is Ana Liffey? Ana Liffey is the spirit of the river nearby, the River Liffey. Ana Liffey Drug Project is established in 1982, so that makes us 41 years old now. We are the first agency founded on harm reduction principles in Ireland. I think the reason we have been innovative is our low threshold culture, where our main mission is to engage with people who use drugs and have other complex needs as well, and help them find solutions or to reduce the harms that these issues cause. And how we do that is by working with people on an outreach basis, working with case management, in conjunction with them. We don't tell them what they're going to do. We work with them in terms of setting their goals. If they've no interest in becoming drug-free, then they want to become more stable, that's the goal for them. That's what we're going to work with on them. If they need to address their housing, that's what we'll work with on them. We also have a fantastic nursing team that are responding to people's physical health. And we work with people around, say, dual diagnosis, mental health and addiction issues. We do backpacking needle exchange. We do needle exchange in our mobile outreach vehicle, the Ana Liffey.
It's pretty much an ambulance that's been transformed into an harm reduction van.
Let's get inside the van. Can you show us around?
I'll show you around. Yeah, Peter, so that is basically the Ana Liffey, okay? So it's our harm reduction vehicle. Basically we go out 3 times a week in different places of Dublin, mainly in the north. We have everything here to kind of provide quick, clean equipment. Confidential harm reduction support, needle exchange is one example, but also overdose education. Crack cocaine at the moment is really a big problem. We give crack pipes. People are sometimes smoking drugs, crack or otherwise. We have the naloxone, so we have different type of naloxone. Obviously, we have the nasal naloxone and then the intramuscular, so you inject like this. So it's possible that sometimes you may give that also to service users. We train people to use it. If you have someone who's kind of in an emergency situation, who's kind of unwell basically, who may be overdosing or may just have a mental health crisis, whatever, we have a space where we can really do and work with the client around that. Someone can have a key worker pretty much instantly. You know, you don't have to wait for days, and you know, it's just right away we can work with someone, and that's what I really like.